Great. I think we can get started. Great. Good afternoon, everyone. Thank you for joining today's virtual briefing on NAIRHHA Day. My name is Anusha Qureshi. I'm a public health program coordinator with the Hepatitis B Foundation. And Stella, if you could move to the next slide, please. Thank you. So as we get started, please take a moment to introduce yourself in the chat by sharing your name, location, and your organizational affiliation. We are very excited to have you with us. Next slide, Stella. Thank you. So before we begin, just want a quick note on our lead organizations. First, we have the Multicultural AIDS Coalition, or MAC, which is based in Boston, Massachusetts. MAC's mission is to mobilize communities of color to end the HIV epidemic through education, advocacy, and community engagement. We also have the Africans for Improved Access initiative, which provides HIV and STI prevention, education, and support services specifically tailored to African immigrant and refugee communities across Massachusetts. And then finally, we have the Hepatitis B Foundation, which is a national nonprofit dedicated to eliminating hepatitis B and addressing liver cancer, as well as improving the quality of life for people living with Hep B. One of our key initiatives is the Coalition Against Hepatitis for People of African Origin, or CHIPO. CHIPO includes over 60 members from across the US and Africa, serving as a collaborative forum to share information, best practices, and build capacity. The coalition works to increase awareness, testing, vaccination, and treatment for hepatitis B in African communities that are disproportionately impacted. Next slide, Stella. Right, so we have a packed agenda for you. We'll begin with the panel discussion featuring some of our incredible community partners, followed by an interactive Q&A session where you'll have the opportunity to engage directly with our speakers and panelists. And then we will wrap up by sharing some additional resources to help you learn more about NAIRHHA Day and how you can stay involved and connected. Next slide, Stella. Before we begin, just some housekeeping rules. Please keep yourself on mute when you are not speaking to minimize any background noise or disruption. Please use the raise hand feature on your Zoom platforms or your phones if you would like to share a comment or ask a question during the session. If you experience any technical issues, feel free to use the chat function. One of our team members will be happy to assist you. You can also type your questions into the Q&A window when we get to the Q&A session. And just a friendly reminder that this webinar is being recorded today. And with that, I will hand it over to our MAC partners.
All right. Good evening, everyone. My name is Agatha Digwe. I am a program coordinator at the Multicultural AIDS Coalition in Boston. And welcome once again to the 2025 NAIRHHA Day virtual briefing. I'll be sharing a brief overview about NAIRHHA Day. So NAIRHHA Day was officially formed in 2014 by a group of community leaders and organizers across the US in states like Georgia, Massachusetts, Washington State, and Washington, D.C. It's designated to be celebrated every September 9th because September is commemorated as the National African Immigrant Heritage Month. So, you know, what's better day to do a special event for Africans other than the month for Africans. The goal of NAIRHHA Day is to raise awareness about the impact of HIV and viral hepatitis in African immigrant and refugee communities in the US, basically because we've seen that these diseases affects our communities at a significantly higher rates compared to other groups. And since the inception of NAIRHHA Day in 2014, lead organizations have been making efforts to gain national recognition for NAIRHHA Day. So in 2023, one of our champions, like our biggest champion actually, Representative Hank Johnson, co-led efforts to secure a national recognition for NAIRHHA Day at the House of Reps level. And in the same year, efforts to realize the listing of NAIRHHA Day on the hiv.gov website. So NAIRHHA Day is officially recognized as a federal health observance. And this year, We also received, like, we were acknowledged by the Boston Public Health Commission when they shared a newsletter to members of their listserv talking about NAIRHHA Day and inviting folks to these events. So NAIRHHA Day has come some ways so far, and we are still working on advancing the mission of NAIRHHA Day. Now, Stella, if you would like to share the next slide. All right, so part of our efforts in making sure that we continue to move the needle forward for NAIRHHA Day is the updated NAIRHHA Day toolkit, which we have presently on our NAIRHHA Day website. This toolkit has everything, like it's a very comprehensive resource for all things NAIRHHA Day, from what is NAIRHHA Day to the leading organizations, to the history about the day, to different tips and tricks on how to like host events, ideas for fundraising, ideas for different events, how to engage with legislators. It even has like templates for those engagements, from scripts to letters to petitions. It gives you advice and resources on how to even engage the community around NAIRHHA Day. And to some extent, these templates or these resources can be applied to other aspects of our work, not just NAIRHHA Day. And so please feel free to grab your copy of the updated NAIRHHA Day on the NAIRHHA Day website. If you have any questions, please don't hesitate to reach out to any one of us with your questions or concerns. Next slide, please. All right. So, as I said earlier, Rep. Hank Johnson is one of the biggest champions of NAIRHHA Day, and he was unable to join us today due to other commitments. But we do have a video remark from him, which he wanted us to share with everyone present. And so, Stella will just play that for us now.
Good evening, everyone, and thank you to the Hepatitis B Foundation, the Multicultural AIDS Coalition, and the Coalition Against Hepatitis for People of African Origin for inviting me to give remarks for the official recognition of NAIRHHA Day. This year is the first time NAIRHHA Day will be federally recognized with a resolution that I plan to introduce tomorrow. I'm sorry I couldn't be there with you in person, but as you probably heard, things are a little hectic right now on Capitol Hill. As co-chair of the Congressional Hepatitis Caucus, I appreciate the opportunity to work with community members like you to create a more equitable country. By introducing a resolution in the House of Representatives to designate NAIRHHA Day a federal health observance, I hope to bring much needed national and local attention to the HIV and viral hepatitis needs of African immigrants living in the U.S. Addressing some of those unique issues that African immigrants in the U.S. face through awareness, education, and resources, NAIRHHA Day will empower communities to take charge of their health and ensure that this issue will not be overlooked. Thank you all for the work that you do to help eradicate hepatitis and HIV/AIDS, and I look forward to continuing to work with you. Have a great evening, everyone.
Okay, all right. So that was the remarks from Rep. Johnson. As he mentioned, he is also this year he is also working on reintroducing the bill to the House, and that way we can continue efforts to get it recognized at the Senate level as well. So that's why he made the comment about getting it recognized. So for this year's NAIRHHA Day celebration, we decided to go beyond just like a one-day event to try and make it more interactive and more participatory, right? So people get to, know about NAIRHHA Day and hear about it more than just in September. So we hosted a NAIRHHA Day bingo game challenge, right? So it ran for the entire month of August, and the idea was folks completed a row of activities, either diagonally, vertically, or horizontally to win. And it was about all things NAIRHHA Day. So it had folks completing different activities around NAIRHHA Day. Next slide, please. And then we also then had this, we also then brought in this virtual briefing. The briefing is a place as we are gathered to, talk about NAIRHHA Day and partnerships, as well as all things needed to continue to strengthen these partnerships, right, to end the HIV and hepatitis B endemic or epidemic rather in African immigrant communities. So we have powerful voices who are experts, both lived experiences and professional experiences in leading discussions around HIV, hepatitis B, talking strategic partnerships and collaborations, but all with African immigrant communities. They've worked all with African immigrant communities. So now I would hand it over to Chioma, who will lead us in the panel conversation.
Thank you. Thank you very much. Hello, everybody. My name is Chioma Nnaji. I am a Senior Program Director at the Multicultural AIDS Coalition, which is located in Boston, Massachusetts. I am happy to be here with you as we celebrate another September 9th NAIRHHA Day. And so today we have an amazing panel that is going to talk about NAIRHHA Day from various lenses. If you can share the next slide, please, Stella. NAIRHHA Day was always built and developed based on the voices of community. As Agatha said, it was started by community leaders, community advocates, community organizers, and really centered the voices of people who have lived experiences. And so we want to make sure that stays core to NAIRHHA Day. So before we bring on our panel, we actually want to hear from some of our community members who have lived experience. So we're going to hear from two. The first person that we're going to hear from is Manu Flomo. Manu is going to share his story of living with hepatitis B.
Throughout my life, I've known myself to be a fighter. When I was 1 year old, I lost my mother, and I was raised by my grandmother during the Civil War. Our home often housed nearly 20 other people seeking refuge. I saw my grandmother as she cared for pregnant women in one of the rooms of the house. She helped them give birth whenever they couldn't reach the hospital. I learned to be strong and independent from her. After I finished high school, I volunteered with a group helping with the Ebola outbreak. Then I wanted to try for the greatest country in the world, so I decided to apply for university in the US. Getting there from Liberia was a challenge, but to cover costs for the journey, my grandmother sold half a land. She was determined to help me. I worked all hours during DoorDash, tutoring assistant at the school front desk to cover my tuition. Graduation brought me a mountain of debt, but I didn't let that to stop me. When I was accepted into a Master's of Nursing program, I went through the health check for admissions. That's when I found out I have hepatitis B. The school tried to rescind my acceptance because of the virus. I started Google searching and I found out that in the United States, there are laws that prevent discrimination in education. I wrote an essay defending my position. My doctor checked my liver health, and my viral load was almost non-existent. I called the school every day to check on my application status. Eventually, they relented, and in a few months, I will graduate with my nursing degree. I have always been a fighter, like my grandmother, and I won't let nothing, not even hepatitis B, keep me from my dreams. Just be optimistic.
Manu couldn't be with us today, but we are so appreciative of him standing up for himself because what he has done is set the stage for people who are going to come behind him. So thank you, Manu, for your advocacy, and thank you for what you've done, and congratulations on graduating. And I want to also highlight the fact that you can hear other stories around hepatitis B by going to the Just B website. Hepatitis B Foundation has a catalog of various stories from people from various countries, not just Africa, so that you can hear their story. You can use it as part of your work, as part of your education to and with community members. So we also are going to hear from a dear friend of mine, and someone who I look up to and actually mentors me in a lot of ways in HIV advocacy work. Helen Zimba. Helen Zimba is going to share with us her story on living with HIV. Helen?
Thank you, and thank you for having me. Good afternoon, everyone. So my name is Helen Zimba. I am a daughter and a mother, and I am also a grandmother. So I take pride of that because that's who I am. I'm a Tumbuka tribe, but also Ngoni tribe because my mom, my dad, come together. So I'm a warrior pretty much. My middle name is Limbani, which means be strong. And you know how our African parents had to give us a name that means something. So my name is like be strong. So I try to live up to that as much as I can. I raised up in a traditional house, even though we were in the city. But it was so traditional. So because of that, I still live traditional life with my children here in the United States. I live in Dallas, Texas. I am an advocate and I am part of the ASHE group, which I'm so proud to be around other women. I've been living with HIV for almost 34 years and I live openly about my diagnosis. The reason why I do that is because I feel like there's nothing that I can do without talking about it. Things have to be done. I have to be heard. My voice has to be out there. But not to say that everybody can do that, but that's me. That's what I do. So I live openly about my diagnosis, in advocating for myself and for others. So in our share group, we do exactly that. And now I'm also part of the HIV caucus, also representing the ASHE group so that we can have our voices also heard, making all those policies, having a say in some of the things so to keep things going. So I want to say that for me to live out loud about my HIV was not easy because of the stigma, which is still here up to now. Even though HIV has been around for 40 years, stigma, it is still real. I still find myself trying to figure out where is the safe place to access services. So because when I got diagnosed, first of all, I was looked at, okay, I'm Black, I'm an immigrant, I am underserved, pretty much underinsured. So where do I go? So all those things, they're still happening up to now. And I feel that it is very important for us to be talking and to be making these right connections. The connections are there, but are they the right connections that we need to make? Because we want to be safe, because especially now, the time that we are living in, we are very selective on who we want to share our information with. So when we are talking about HIV and hepatitis, it's something that it is still taboo to people, even though every single person knows somebody who has HIV and somebody who has hepatitis or other comorbidities, but still there is some kind of stigma. So we do have to work on that. So I am so excited that we do have our own day to be discussing about, things that go on in the African community, because our issues might be the same, but they are different. They are different because we might sit in a space where somebody says, I'm just going to go ahead and go to the office and get this help. But as an African, you are like, no, I can't do that because I have some barriers that I can't go. We might be talking about, immigration, or we might be talking about, domestic violence. We're scared to call that 911 because traditionally we're like, you're going to upset your people, So all those things that play a part in our day-to-day life. So in short, I'm glad to be here, looking forward to this conversation centered for us and by us. So thank you for having me.
Thank you, Helen. Thank you very much, and thank you for being a leader in the fight to HIV, to address HIV. So now we get to hear from our panelists, and so I'm going to ask Fatima Inem and Helen to join us. Hi, everybody.
Hello.
Hello.
Yes, thank you. So we're going to start this conversation. Y'all didn't know about this question, but I'm going to throw it at you anyway, because I know you're going to be able to handle it. Because I always think it's important for us to bring who we are into the space as we talk about something that is hard. It's hard to talk about, right? And it's something that we are constantly dealing with in our community. And so I would like for you all to introduce yourself, but as a part of introducing yourself, if you could please share, what is it that you appreciate about being African? What is it that you appreciate about being African? What is it that you love about being African? So if you can answer that question and also introduce yourself. Anybody can go. I know Helen just
Yes.
spoke, so maybe yes, okay.
Yeah. Hello, everyone. My name is Fatima Omorifillo from Montefiore Starfish Program, Bronx, New York. And I am the patient navigator for Hepatitis B with the Starfish Program. And I'm happy to be an African. And I'm happy to be part of the panelists today. And as your question goes about me being an African and being able to work in my community to speak about a stigma infection that people are ready to listen just for the fact that they don't understand much of the Western health system and scared to come and do any testing in the hospital. When someone from different ethnicity, or let's say a white person, go to a Black mosque or church to present to them about a stigma issue, they will listen to you, but they will not participate in anything that you will do, for the fact that they believe that you're going to take their information for something different, or you're going to take their blood for something different. So for me to go and present to more than 300 people, and let's say more than 150 to come forward to the hospital, not on-site blood drawing, but to come to the hospital to get their blood drawn for testing, for them to have that trust relationship with me, makes me very happy to be an African.
Oh, thank you, Fatima.
Thank you.
Thank you for your work. Ina?
Well, hello, everybody. My name is Inem Olubajo. I am Nigerian, and I am affiliated as program director for the Coalition of African and Caribbean Communities in Philadelphia, Africa. Let's see. I'm going to first answer the question before I delve into Africa, because then I'll just keep on going. All righty. I love being African because of just that identity. You know, you can proudly walk out there and say, yes, this is who I am, from your name, from your food, from what you wear, you know, that accent, which the foreigners, which I will call them that, do not want to accept. It identifies me for who I am. Yes, I know I can speak the English way, of which when they look at my name, they will turn around and look at me like, where are you from? And I'm like, I'm from Camden, New Jersey. And they're perplexed, which totally throws them off. And I can also turn around and speak my pidgin And so what? Waiting you, waiting you to talk about, So it's my identity that I clearly hang on to and love. I love Nigerian food. I love Akwa Ibom food. I love afang soup,
Yeah.
jollof rice, yay.
You say Nigerian jollof rice though. Be
Okay, all
specific.
right. We have to be specific.
Yes, you
Thank
better be
you.
careful with that because Ghana jollof rice tastes better
No,
than Nigerian.
no, sister. No, let's not start a fight here. But anyways, I love as an individual being a public health professional where working with the grassroots at AFRICOM, whose mission is to advocate for immigrants and refugees to help them be self-sufficient, in America, in the Philadelphia area, helping them to find resources per se. This is what I went to school for. I am going to school for, to help our people understand that there is help out there. There are resources for you. Just talk to somebody. Do not be afraid to open up to whosoever you think will listen to you, because that's what we are here for. We have this stigma, as Sister Helen said, that shame to like not talk about things. And the more we hold it in, the more we hurt ourselves. That is very true. You never know where help is going to come from. So you want to be open, as Sister Helen is saying. She talks, to people, and it's not just HIV that holds stigma. Somebody having a seizure, they don't want to talk about that. Epilepsy, they don't want to talk about mental health. There's no, I don't think, anybody can correct me, if there's any word in the African language, any African language that has a word for mental health. I was talking to my mentor and he says, oh, we have a word for it. I'm like, but if you translate that into, let's say a handout, a health handout, practically is going to say crazy. And that is not what mental health is. So there's language barriers as well that we also have to work with here in our communities. And that's what we're here for. Thank you.
Thank you.
Ms. Chomo, I just wanted to tap a little bit on the language barrier that Ms. Inam just mentioned. As during some of the presentations that we do in the African community, language barrier has played a huge role that we are not actually looking into it, because there are a lot of undiscussed issues beneath both hepatitis B and HIV. Some of these communities do believe that hepatitis B is tuberculosis. Others are thinking that when you tested negative, that means you are safe. Due to language barrier that is not being break down to the layman's language to them, that when you are negative for the virus, then you have to know if you are negative also for the antibody. I came across so many people that feel they tested negative and they didn't bother to do anything else. And one of them actually said he was negative for both, and he just have to come for testing to be sure that he wasn't immune. So going out there with the layman's language for them to understand is huge, especially for the community that you understand they have less understanding of English. So that is one thing that I actually wanted to make sure that I share it on NAIRHHA Day for us all to put more outreach program in layman's language that this community will grab at least on NAIRHHA Day. Thank you.
Yeah, you all are bringing up a lot of barriers that we see in our community as it relates to outreach, education, and even people seeking prevention and treatment, right? So stigma was brought up, language barriers was brought up, and being able to have conversations with people in their language, and have materials in their language. What do you see as some of the barriers that are happening at actual hospitals and institutions or community health centers, right? So when you either have to navigate a client or maybe you are trying to work with a client's doctor, what are you seeing as some of the challenges happening with providers and the healthcare system?
Again, I'm going
So
to
I can,
go ahead.
oh, I can say that, you know, being a peer, I find that a lot of people tell me things that they don't tell the doctor.
Mm-hmm.
They'll tell me things as a peer, but they won't tell the doctor. You know, they'll say things like, "Oh my goodness, I cannot take this medicine because it's so big, but if I tell my doctor, they're going to be mad with me." Or I'm not taking my medication because I have to hide them because nobody knows about my diagnosis in the house, so I can't take them. So, you know, they're supposed to take 3 times a day, but they're only taking it once a day because that's the only time they can. So what's missing is giving people the option, because there are options. Like as for HIV, there are options. If my person is comfortable to talk to their doctor, they can switch to once a day, and then that solves that problem. But because sometimes providers, the barrier to me I see is that we go too much with authority, you know, when we are speaking to the people that they serve. You're like, this is what you do, this is what you do. You're not even listening to the person. This person is coming to you most of the times. They're like, you know, I want to tell you the reason why I'm also proud about being African is because I feel like I can sense things. I can sense things because when somebody comes in, I'm not judging them, but I can tell. I guess as a mom, as an auntie, I can tell. I'm like, what else is going on? Because what you're coming in this clinic sometimes might not be the only thing. They might be homeless at that time, but they're not saying all that. So I can sense those things. So I can switch, you know, from, you know, talking about what you are here for. Let's talk about this first so we can get to what you're here for. You know, so that plays a lot in, you know, so yeah, so the reason why sometimes there's disconnect between, you know, our clients or ourselves with the providers is the way they talk to us. And also with the way they give us the information. They'll just give you information. They say, hey, here you go. Well, you don't even know if I can read. You don't even know if I can understand it. You know, so that's one of the barrier. And like Sister Fatima talked about language barrier, you know, that's another thing too, because it's not just about speaking English, it's about understanding. I can speak English, but I might not understand exactly what you mean. So that's a barrier too. And there are cultural differences.
Yeah, Ms. Choma, I just wanted to add a little bit on what Ms. Helen just said again. The providers need to change their way of approaching these patients when it comes to medical terminologies, especially telling a patient, if you don't do ultrasound, you may end up with cirrhosis. Out of 100%, I would say maybe 30% understand what is cirrhosis.
Right.
You could put it out there, you may have liver cancer. So using the right language to this patient does play a role. A patient called me this afternoon, maybe like an hour ago, and she said to me, if I have time, she wanted to ask me something. I said, okay, go ahead. And she said, Miss Fatima, do you know the side effect of the medication I'm taking for hepatitis B? I said, so far, we've not come across any side effects that has harmed any patient yet. But I just want you to understand, even the common Tylenol you take as a medication has some side effects. And she said, I don't want to tell my doctor, but I want to stop taking the medication. I said, I'm not going to advise you to stop the medication. When was the last time you did blood works? And she said, like 6 months ago. I said, try and make the appointment. Go and do the blood work. Depending on what came out from the blood work, if you see the trend of your viral load has been descending to the undetectable level, you could work it out with your doctor. But of course, we don't want you to end up not taking it and then develop any flare for you to get cirrhosis. So discuss it with the doctor and let them understand if you want to withdraw from the medication, that means you have to go for blood works every month in order not to develop anything serious with your liver. And she was happy with this. But you see, she's scared to discuss this with the doctor. And she told me she's not going to discuss it with the doctor. She's just going to stop taking the medication. So think about if I wasn't there to give her this advice to do that, she's going to end up not taking the medication and it's going to lead her to liver cancer. So we have such minor issues, undiscussed problems that these patients are facing, and putting a lot of navigators that they can connect well with would definitely save one life from getting liver cancer.
Amazing. Thank you for that story. Thank you for that story. Um, I I did want to touch a little bit on and hear from you all. You know, we're in a very trying time right now. With what's happening at the federal level, with who's are in our administration, with cuts that are happening in HIV, cuts that are happening in hepatitis, um, and also with what's happening around immigration policy. And I think often what happens is that the voices and experiences of African immigrants are not part of the bigger conversation around immigration. And definitely, we know that there are people on the ground doing that work. And I know that it is touching some of the work that you're doing. So, can you share a little bit about what you're seeing in terms of the impact of the current administration, the things that they are doing and putting out there? What impact has that had on you and serving clients and even with ways in which you try to support your clients?
I'll go.
Mhm.
Well, the administration is making things particularly difficult in that our community, people are petrified. That's the word to use. They don't want to go to the doctors.
Mhm.
They don't want to go to white hospitals because they are afraid that this is going to lead to deportation, you know? So, with their health being, in their hands and them going back to a country that might not even be theirs, they don't even want to step out of the house. Right now, in the Delaware County area here in Pennsylvania, we've practically lost a whole health care system. So we are a care desert where all of our, you know, African immigrants don't even want to go to the mainline health because it's a white hospital, majority white. They're the minority. Their accent is going to come out. They're going to get brushed. It's like if they're like white people in the emergency room that are still waiting, why are they even going to like wait on me? So they don't even want to bother. It's like, forget about it. So it's like compiling more health issues upon health issues that they already had. The Newlands Health Clinic, which has opened up another center in Frankfurt area, Northeast, has offered to open up on Saturdays so that our community can come in, and I have to commend them. You know, they will stay as late as they can on Saturday, making sure that they see anybody that walks in. So that's what we're doing right now.
Thank you. Thank you. I mean, it's great to hear. You already started talking about strategies because I do want to, focus on what's working, right? We know that there's a lot of things that are challenging. We know that there's a lot of systemic barriers, but you all are doing the work. You and colleagues and others are doing the work. And so Fatima brought up navigators, the importance of navigators. Helen, you said you're a peer. What exactly is working? So that we know that we are supporting our community and getting the education and getting tested and getting into treatment, getting into care. What are you seeing out there that's working?
Actually, I think trust is the biggest key. Although I have not gone out for outreach for the past 3 months due to the loss of my husband, but before then, the last presentation that I did, people did came for testing, as at that point it wasn't out there that they can use your medical records to deport you or whatever with the immigration issues. But I use the word trust and also connecting partnership with the faith-based organizers, the leaders, for the fact that it had worked from the past with the Starfish program. So once you build that trust with those leaders, for them knowing that you're not going to use their medical record for anything other than to let them know the status of what they have when it comes to hepatitis B. That trust alone is the key. Once you break that boundary of trust, you can move forward with any other thing. So from my perspective, the trust is the key. And also making sure that whatever you put out there to the community is what is being performed when they come for testing. So building that strong relationship and making sure that you have somebody that during the presentation that comes with you, for them knowing and seeing that particular face. And when they come for the testing in the hospital, as Miss Inam just use, like, not an African hospital or clinic, for them to come there and see that same face as a helper or as an assistant, or who will direct them on where to go, would definitely play a role that will let you be able to bring more people for testing. Because once they get to the main entrance of the hospital and they see different faces that they don't even speak clear English for them to express what brought them there, that alone can throw somebody back home and wouldn't wait for the testing.
Yeah,
So,
I
as I
mean,
said, the trust.
and you're making a very strong point. The trust is not just the trust with the provider, but you're talking about the trust from the moment that they get to the health facility.
Yes.
And what is their experience from when they're greeted at the reception desk, or even maybe greeted by the parking attendant, to when they actually get to see their provider and being able to build that trust. The other thing I heard you say is do what you say you're going to do. I know I learned that in my own work, that if I'm in the community talking about, services we provide, or even talking about how I can support them in navigating them somewhere, and they call me, I better show up and do what I say I'm going to do.
Yeah.
Because the minute that I don't, then that again breaks trust, but it also is like fills the community with that's not a place that you want to go, right?
Absolutely. The
So
reason
thank you
why
for
I
sharing
stick
those.
to, yeah, the
Mhm.
reason why I stick to that is that I remember from, let's say, 2018, the PowerPoint presentation we had, when we come to almost to the last part of it, we indicated that when you come to the hospital, we're going to draw only 1 tube of blood for the testing.
Mhm.
Not knowing that when they go to the lab, they take 2 tubes, one for the surface antigen and one for the surface antibody.
Mhm.
After like a year, we went to the same place for a second presentation due to the number of positive individuals.
Mhm.
And one person stood up and said, "You lying.
Mm.
You lying. You said 1 tube, and when I went, they took 2 tubes. They took 2
Yeah.
tubes from my brother."
Yeah.
Like, oh my God, Dr. Emmanuel, we are in trouble.
Yeah.
So we went back
Yeah.
to find out why were they drawing 2 tubes, and they explained to us is one for the surface antigen, it goes to different departments, and one
Mhm.
for the surface antibody.
Mhm.
So we have to go back and make that correction on the PowerPoint that you're gonna get 2 tubes drawn,
Mhm.
one for this, one for that.
Something
So
that small. Yeah.
yes,
Yeah.
you have to be what you are on your PowerPoint.
Yeah.
You can't change anything of what you go and stand there and tell them. So that trust, imagine how many people he might have convinced not to come for testing there.
Right. Right.
So that is very powerful
Yeah.
when it comes to African community.
Yeah. We have a question in the
Yeah.
chat that I think is very important, and I know we have only about 6 more minutes, but I do think we should get to this question because I think you all have some strategies you can offer. Michael asks, are there any concerns from your clients about attending a clinic where they may run into members of their own community and inadvertently be outed? Now, have y'all experienced that? And
Always.
if so, what are some strategies have you used to address it, to minimize it?
Always. For us, we were always going through that because people didn't want to make an appointment because they didn't want to bump into somebody. But, sometimes it happens, unknowingly, and it happens, but we have to let them know to say the reason why they're here is the same thing. So, not that we might as well know each other, but, they end up, when that happens, people end up being friends. They end up, being connecting with each other, being support to each other, just like that. But then because they know that if they go and talk about somebody else, then they're talking about themselves. Because I was there, why were you there? But
Like, how do
yeah,
you know?
yeah. How do you know?
Mhm.
How do you know the medicine I'm taking? It says in the bottle, but you know it because you're taking the same thing. So yes, it happens. I mean, I don't assure people that you won't meet anybody that you know, because I don't know that. They might meet them. So I don't promise them that they might meet somebody. But I do assure them that I am not going to talk about your diagnosis with somebody else. You do it yourself if you want to. So it's good to tell people exactly what it is, because the truth is we can't control that. They might be in the parking lot. You might go to the same pharmacy and they see the bottle without even saying it. They'll know what it is.
Yeah, there is,
Unfortunately.
I'm sorry, there's a case of confidentiality of
That's
which
what I was going.
it
That's the word.
has to be like cemented from the
That's the word.
get-go.
Mm-hmm.
It's like, we don't tell anything about you to anybody. Just like you wouldn't want somebody to know what is going on in your personal house, your financial businesses, that is the same thing here. You have to like let them know it is safe. And as Sister Fatima was like saying, building that trust, that is part of it, that empathy to like say, I understand what you are going through, but we are here to make you feel better, this is what we're working towards, you have to like also give them a break, let them take their break, but call them back in per se, and let them finally talk to you, and from there, that connection will be built.
Yeah.
And
Also,
like
in here,
for
when you
me,
come to
oh, go ahead. Go ahead.
sorry.
Go
When
ahead.
it comes to confidentiality, I think this is very important. Right from when you are out there educating them, you must let them understand. It's like going to the doctor's office. Whatever is discussed there stays there. And if somebody you know happens to be a patient, what I do with that, actually, I don't confront them. I don't even let them know that I've seen them. I try to minimize my confrontation with them just for them to have that courage to come there again. And if it happens that I have to meet them, I let them understand where they are and let them also feel that they should feel secure with me, that is their health, and I'm happy that they can come to find out what is going on with their health. And it is a hospital setting and it's not going anywhere. So you must try not to kind of, let's say we will meet at a mosque or at a church with somebody that I know is positive, to try to build like communication with them out there, which will signify something to the rest of the community. So such are the keys that you must try to avoid all those. You can have conversation with them when they come to the hospital or over the phone, but try to minimize yourself from exposing them by communicating with them in the public.
Yeah.
Mhm.
Well, ladies, our time is up. It went quick.
Very quick.
It was very, very quick.
Very,
Yeah.
very
And
quick.
I think, I mean, we can talk about definitely. I'm happy to hear that you all are doing the work, and I appreciate the work that you all are doing. And even though we can continue to uplift barriers, we have to continue to uplift what is working. What are the partnerships out there? What are the strategies that are happening? And so I hope people got a sense of what they can do in order to really address HIV and hepatitis with African immigrants. I know that you all are available as resources so people can reach out to you all. Thank you very, very much for being a part of this conversation. Thank you again for the work that you do. And we will continue the work until we meet again next year, September 9th, 2026 for NAIRHHA Day. Thank you, ladies.
Thank you
Thank
very
you.
much. Thank you for having all of you, and see you again another time, not next year. Hopefully
Every
something
day.
else
For
will
next
Every
year.
happen.
day.
Yes. Yes. Thank you for that
Yes,
correction. We'll
and
see you soon.
See you
yes,
Very, very
soon.
soon.
apply for those grants. We need the monies, please.
Yes.
Tell them, make your logic model. This is a specific treatment that we're going to be helping. Make it a long-term grant so that it shows that sustainability, and we'll have that data for our African population, please.
Yes.
Thank you. Thank
Thank
you.
Definitely.
you.
Thank you.
Definitely.
Thank you.
Bye-bye.
Bye-bye, everybody.
So I'll
Bye.
ask that everybody continue